You've seen them on Grey's Anatomy.
Look, I'd rip your face off if it meant I got to scrub in.
Medical residents, they're competitive.
So some of the intrinsic factors...
But for current undergrads, the path to getting to that spot may become even more competitive.
Competition throughout college and then throughout medical school, and then at the end of that to come and see that there's no spot for you, it'd just be kind of unfair.
Medical residencies are the necessary training step after med school. They're mostly funded by Medicare, and by law, they're capped at $26,000. Emily Gutowski is a Rutgers sophomore, pre-med. She could be part of the first class of U.S. med school graduates bigger than the number of residencies.
We just hope that by that time something will happen to make it better, but yeah, definitely it's a big concern.
The number of residency positions was frozen by the Balanced Budget Act of 1997, when we were projecting a surplus of doctors. Today, many predict a shortage, so med schools are growing.
By 2018, 2019, sometime by the end of the decade, we're actually going to have several hundred more students graduating from U.S. medical schools than we'll have first-year residency training spots for them.
All the while incurring the huge cost of medical school.
When you're looking at numbers like 150,000, 200,000, my cousin had 400,000, we can't even comprehend that.
Your cousin had
$400,000 of debt for med school.
The last thing you'd want to do in a situation where you're trying to figure out how to fund more residents is to use residency funding as a way to cut the Medicare budget.
Some hospitals, like New York Presbyterian, are over their caps. They're paying out of pocket, but they say they can't afford to pay for the training for hundreds of doctors. There's pending legislation that would help raise the cap. Similar legislation has been proposed several times but never passed. One reason, the argument that taxpayers shouldn't be paying to train doctors.
I don't think that funding more residency slots through Medicare works anymore because of the changing demographics, the aging of our population.
But as of right now, that's where the funding comes from. The president's 2013 budget would cut by 10% money that's used to fund residencies. The Affordable Care Act allowed hospitals to pick up residency spots that other hospitals no longer need, meeting an extra 15 for New York Presbyterian. Governor Romney has said he would repeal Obamacare, but it's otherwise unclear what his health care plans mean for medical residencies.
The reality is, if we don't have a job afterwards, what's our medical degree worth?
Christine Romans, CNN, Piscataway, New Jersey.